The Maxillofacial Restoration Program is a single comprehensive program that is comprised of 9 integrated clinical care pathways. Really, the big difference between John a day and traditional reconstruction in the US and globally is that it takes 2 years of treatment into 1 day. But if your outcome is longitudinal in process, and it is as audacious as restoring the overall health of a patient, that is how we restore form, function, and purpose. The focus is not the procedure. The focus is the patient. The reason we can do that is because we have the communication and the integration, which is unique to the US military.
Something like this, where an Army surgeon, a Navy surgeon are able to work together across the services. That's all part of the Defense Health Agency, and I think that's good for surgeons and doctors to be able to take care of patients.
During my time at Walter Reed from 2011 to 2017, head and neck injuries were the second most common injury in Iraq and Afghanistan. If you look at the current landscape with drone warfare, the new term is top-down trauma. We need a center of excellence, which will then give the confidence to our warfighters, and if they have a head and neck injury, they know that we are standing by to restore their form, function, and purpose.